Hi, it's Gary Chimes from Lake Washington Sports and Spine. And what I want to talk about today is why guidance matters when doing an injection. And I'm going to use an example from the knee and the shoulder. There's basically two reasons guidance is really helpful. The first thing is to make sure you are where you think you are, which increases the likelihood that the injection is going to work. The second thing is to know where you're not. So if an injection doesn't work, then it's going to give you more certainty that you are where you think you are. So the classic example of an injection where people think that they may not need guidance is the knee. And so we're looking at a knee. What we're looking at here is a side view. So we have the femur or thigh bone, the tibia or the main shin bone, and the kneecap. This is the quadriceps muscle and tendon. This is going to be the patellar ligament. So when we do a knee injection, what we're talking about is shown in the red is going to be the actual joint space. And that's like a balloon that is going to be hanging out behind the quadriceps tendon, going between the two main knee bones and having a little recess in the back we call the popliteal recess. And oftentimes you can stick a needle in there without guidance, is what I did for decades, and just pull out the fluid and say, yeah, I'm definitely where I think I need to be. But in truth, a lot of times when people think they're doing a knee injection, they're actually in this area called the fat pad. And it's right adjacent, and sometimes even if you stick a needle and you pull fluid out and you think you're in the right space, sometimes in the process of pulling the fluid out, you actually move the needle tip. So you thought you were in the joint space, but you actually have protracted it from the joint space into the fat pad. So that's a common error. There's a really good series of papers by Madera Call, who is a doctor out of Iowa, who has shown that people miss more frequently than they realize. What's really interesting about that is the more confident people are about their accuracy with landmark injections, the less accurate they actually are in reality. Now this is going to be a shoulder, so what we're looking at here is going to be the humerus or the main arm bone. This is going to be the shoulder blade. The dark brown here is representing the rotator cuff tendon, specifically the supraspinatus tendon, and the brown here is the overlying deltoid muscle. And this thin red area here is going to be the subacromial bursa. So when people say shoulder injections, there's lots of different places you can go, but that's probably the most common, is going to the subacromial bursa. That bursa is really thin. We're talking 1 or 2 millimeters thick in a lot of patients. And so it's very easy if somebody's doing a landmark-based injection to be in the deltoid or be in the tendon rather than the bursa. And that's a problem because even if a person feels better at the time, putting corticosteroid into the tendon can actually cause it to deteriorate. And that's where a lot of people say, hey, I'm concerned about using cortisone because I don't want to get deterioration of the tendon. A lot of that's related to because they actually went into the tendon as opposed to the bursa. So this value of guidance to make sure you are where you think you are is important, whether you're using corticosteroid, whether you're using platelet-rich plasma, whether you're using other regenerative treatments like micronized fat. It's really important to be where you think you are. There's one other really big bonus when you do imaging to do an injection, it hurts less. Because since I can see where I'm going, when we do landmark-based injections, it's often by sticking the needle to touch down on the bone and then pulling back. And that process of touching down on the bone to help you think you know where you are, that actually hurts. So doing guided injections just hurts a lot less. So the bottom line is we have the technology for guidance, we have the skill to use it, so your injection should be guided. Gary Chimes, Lake Washington Sports and Spine.